anatomy or structure, we have from the outside capsule, lymph node capsule, which is a thick band of connective tissue. From this band, we have the trabeculae, fibrous trabeculae, penetrating the lymph node. Okay? Subcapsular zone is the cortex. Under the capsule, we have the cortex. The cortex is the area of aggregates of lymphoid follicles. Lymphoid follicles, we have two types of lymphoid follicles, primary follicles and secondary follicles, lymphoid follicles. The difference between primary and secondary, primary composed of what? Of small lymphocytes, naive lymphocytes, not expressed to the antigen, okay, not stimulated, dormant, inactive. Well, secondary lymphoid follicles here, primary lymphoid follicle gets what? Stimulated by exposure to antigen. By morphology, the primary lymphoid follicle, it is a small, dark, circular structure, okay? Darker circular structure. While the secondary lymphoid follicles containing pale center with activated lymphocytes, this center called germinal center. Okay, بعد الcortex to the inward inside we have the medulla and the hilum. Paracortical space اللي هو space between the cortex and the medulla. This is the normal, let's say, structure of the lymph node that will be disrupted and destructed in a neoplastic process. هذا النورمال بين cortex, lymphoid follicles, germinal centers will be disrupted, okay? Either by structural configuration or by the type of cells infiltrated. نوع الخلايا الموجودة. Sometimes if you look at a lymph node, certain lymphomas بتكون preserved a little bit. لكن لما نيجي نعمل stains أو to identify type of cells, we will see that we have malignant cells, lymphatic cells مثلا, infiltrating and disrupting the normal architecture. طيب, lymph node enlargement causes ممكن نقسمهم to immune mediated, to intrinsic antigens like autoimmune diseases, rheumatoid arthritis, or extrinsic antigen expression like infection. Metastatic malignancies, most malignancies metastasizing to lymph nodes are carcinomas, مش هيك؟ epithelial derived cancers or malignancies. And the third one اللي هو primary malignant process في lymph nodes اللي هم lymphomas. ليش بيكونوا بصير في عنا lymphatic enlargement, lymph node enlargement, either reactive to infectious, intrinsic factor, immune mediated, or metastatic process or primary lymphoma في lymph nodes. طيب, lymphadenitis, inflammation of lymph node, ممكن يقسموا acute and chronic. Acute non-specific lymphadenitis, we will see large germinal centers, neutrophilic infiltration, and maybe abscess formation if we have bacterial infection. Chronic non-specific lymphadenitis, like follicular, ممكن يكون enlargement بالfollicles. We have follicular hyperplasia, lymphoid follicles, seen in rheumatoid arthritis, يعني immune mediated, or toxoplasmosis infection. Paracortical hyperplasia, paracortical spaces with mainly viral infections like EPV or after vaccination. We can experience enlargement of lymph nodes. Third one can lead to enlargement of lymph nodes اللي هو sinus histiocytosis by morphology, okay? Lymphadenitis. But lymphomas, we can divide them into Hodgkin lymphoma and non-Hodgkin lymphoma. Today we'll talk about Hodgkin lymphomas. It is a primary malignant neoplasm of the lymphoid system arising from germinal center B cells. B cells in the germinal center. It has a bimodal age of distribution, 2 age at presentation, ممكن يكونوا between 20 and 30 yearly presentation, or second peak after 50 years of age. Lymph nodes involved, the most common, اللي هم cervical lymph node, supraclavicular nodes. Characteristic of Hodgkin lymphoma, the spread and involvement of lymph node is contagious in nature. Lymph nodes involved بيكونوا ايش؟ متتاليات. Okay? Followed by maybe يكون في عندنا plus minus involvement of spleen, liver or bone marrow with Hodgkin lymphoma, which is less likely. Okay? Most common يكون lymph node involvement only. طيب. هون بس حكينا عن historical information background. First described in 1832 after autopsy of 7 patients with massive lymphadenopathy. This they thought ما كانوا مفكرين إنه it's a neoplastic process. They call it Hodgkin disease. Two scientists, Reed and Sternberg, identified under the microscope abnormal cells seen in this disease, called Hodgkin disease, and they thought it is an infectious process in nature, and the cells after that called the abnormal cells seen in Hodgkin lymphoma called what? RS cells. Lisbela, Reed and Sternberg scientists. Type clinically presented with painless peripheral lymphadenopathy enlargement with no pain, painless, affecting mainly cervical and supraclavicular lymph nodes. Can present with P symptoms. P symptoms include fever, night sweat, and weight loss. Still في patients عندهم weight loss more than 10%, about 10% of body weight. Splenomegaly as well can be seen, and anemia if there is bone marrow involvement, which is only seen in 5% of cases. Histopathology of Hodgkin lymphoma. Of course, we have neoplastic cells. The neoplastic cells called RS cells, Reed-Sternberg cells. Plus what بيكون beside this neoplastic cells في عنا inflammatory non-neoplastic cellular infiltrate. These cellular infiltrates مش useless, okay? Their presence is important for the survival of the neoplastic cells, the RS cells. بصير في cytokines released by the environment, the milieu يسموها, اللي non-neoplastic inflammatory cells surrounding the RS cells, secrete cytokines important for the survival and function or proliferation and presence of the RS neoplastic cells. Type. Characteristic of the RS cells, they are large cells, contains single multilocated nucleus, okay, multiple loops, multiple small nuclei, and abundant pale staining cytoplasm. راح نشوفها كمان في upcoming slides. Type. Classification of Hodgkin lymphoma divided into 5 types or subtypes. The first 4 called classical subtypes. They are classical, shared immunophenotypic morphologic features of the RS cells. They are share the same features of RS cells. Okay, يعني the RS cells of the first 4 اللي هم classical Hodgkin lymphomas, the same phenotypic and immunologic or immune marker presentation. They are the same in the first 4. Number 5 اللي هي nodular lymphocyte predominance بتكون different. راح نشوف in which aspect it's different from the first 4. 4 subtypes اللي هم classical Hodgkin lymphoma, nodular sclerosis, mixed cellularity, lymphocyte depleted, lymphocyte rich. They all share the presence of classical RS, Reed-Sternberg cells, okay? And there is يعني variation in the milieu, the environmental inflammatory milieu, اللي هي inflammatory cells surrounding them. تمام? And presence absence of fibrosis and nodular formation. من هون إجا أسمائهم: nodular sclerosis, mixed cellularity, lymphocyte depleted, lymphocyte rich. Okay? Regarding etiology, some hypotheses supporting that it has viral basis, the Hodgkin lymphoma. EBV is found in 70% of cases in mixed cellularity subtype, for example, and smaller fraction, يعني percentage أقل في other forms of classical Hodgkin lymphoma. Also, genetic basis and predisposition for the development of Hodgkin lymphoma. كانوا في عنا 5 types for classical, and some comparisons between them. رح نحكيهم when we talk about each one by itself. طيب, the classical Hodgkin lymphoma, morphologic feature of RS, classical RS, it is large cell, multilobated nucleus, prominent nucleoli, abundant cytoplasm with 2 mirror image nuclei or a nuclear loop, acidophilic nucleolus, okay, surrounded by clear zone, kind of clearing around it, and binucleated or bilobated nucleus, nucleoli, and clear zone around the nucleolus. This gives the appearance of what's called owl eye appearance of the classic RS cell. حكينا كمان في عنا non-neoplastic inflammatory milieu or background. These are reactive cells, lymphocytes, mainly CD4, small lymphocytes, histiocytes, macrophages, eosinophils, plasma cells, neutrophils, fibroblasts, and fibrous connective tissue, seen mainly in which type? In nodular sclerosis. Sclerosis from snail, fibrous band, dividing the lymph node into nodules. Okay? طيب. Immunophenotypic expression immunomarkers of RS cells in a classic type. حكينا classic type, they all share the morphologic and immunophenotypic markers between them by the expression positive for CD30, CD15. The RS cells بيكونوا 15-30 positive and negative for common leukocyte common antigen اللي هو CD45 and CD20. CD20 اللي هو B cell marker, صح؟ وال RS cells they are B cell marker لكنها mutated. They don't express CD20 nor CD45. ماشي? And expressing 30 and 15. In which types? Classical first 4 types. هاي مثلا picture the CD30 immune stain, Hodgkin lymphoma, large cells showing positivity for membranous and perinuclear positivity for CD30, okay? And the same cells اللي شفناهم في الpicture اللي قبل, they are negative for what? LCA. The background lymphatic or inflammatory infiltrate around are positive لأنه هو common leukocyte antigen. لكن ال RS cells are negative for CD45. طيب, briefly نحكي عن few subtypes للHodgkin lymphoma. Nodular sclerosis type, it is the most common type. سألنا عن most common type of Hodgkin lymphoma, it is nodular sclerosis, affecting with no gender privilege or preference, men and women the same, adolescent age group, younger age group, okay. Lymph nodes involved cervical, supraclavicular, and mediastinal lymph nodes بالترتيب. Presents at early stage, so it associated with good prognosis. رح نحكي عن staging of Hodgkin lymphoma, usually present at early stage, and it is it has an excellent prognosis. Nodular sclerosis type also histopathology. Something called lacunar cells. They are RS cells. هذول variant من ال RS cells, من ال classical RS cells. حكينا ال classical اللي هم عاملة أو ال I, okay. Variant منهم مثلا بيعطي lacunar cells. lacunar شو يعني lacuna أو lacuna؟ اللي هي الروم أو space اللي around the nucleus. هذا retraction من or artifact من the processing histopathologic processing. يعني في عندنا cytoplasm لكنه راح بالprocessing فبتبين بال H&E sections as clearing around the nucleus. So lacunar cells, it is a particular variant seen in nodular sclerosis more. Large cell, single nucleus, multiple small nucleoli, and abundant pale staining cytoplasm. هذا بصير له clearing with the processing. طيب, also it's called sclerosis type. So في عنا sclerosis, collagen band dividing the lymphoid follicles or lymph nodes into nodules. Nodules. In between we have thick collagen bands. Okay? Background cells, lymphocytes, eosinophils, histocytes. Type. We have patient, 33-year-old female, presented with fever, night sweats, and generalized malaise. Patient presented with non-tender, painless, cervical supraclavicular lymphadenopathy. Cervical lymph node biopsy performed and showed RS cells اللي حكينا عنهم with large small lymphocytes and band of fibrosis بالlymph nodes. Most likely this is what Hodgkin lymphoma, which type اللي هو nodular sclerosis. طبعا إذا كمان عملنا immune stains and come supported with CD30 positive, the large cells, CD15 positive, negative for CD45 and CD20, large cells. طيب, the second type اللي هو mixed cellularity. It is common in older age group, more than 50 years of age. Younger age group حكينا nodular sclerosis. Account 25% of Hodgkin lymphoma, male predominance. If we compare it with the other one, كان ما في عندنا preference بالnodular sclerosis. More likely to be disseminated and associated with systemic manifestation if we compare it to nodular sclerosis. So it presents with advanced stage and poor prognosis, mixed cellularity, poor prognosis compared to nodular sclerosis. In histopathology, we have numerous easily identified classic RS cells. Can be seen easily, okay? مع mixed background inflammatory cells. Nodular sclerosis, it's not that easy to identify. Sometimes certain subtypes not easily can be identified with RS cells. Okay? Like in mixed cellularity, we have numerous classic RS cells, and background from its name, mixed lymphocytes, eosinophils, macrophages, and plasma cells. This is the classic variant of RS cells, classically اللي هو owl eyes with mirror image, okay, binucleated nucleus. So it is male. Male are affected more. B symptoms are common. What are the B symptoms? اللي هم fever, weight loss. تمام. Present at advanced age, stage 3 and 4, while prognosis is unfavorable. Another type بس نشوف picture اللي هو lymphocyte depleted. بيكون عندنا more what? Large cells. Okay. اللي هم more والbackground from its name lymphocyte depleted. بيكون ما في عندنا كثير inflammatory background. Okay. This type affecting older age and which patients with AIDS, okay? Patients with HIV infection. طيب, نيجي non-classical variant أو subtype من Hodgkin lymphoma اللي هي اسمها nodular lymphocyte predominant type. Count 5% of all cases of Hodgkin lymphoma. ليش في صوت؟ Affecting primarily younger male less than 35 of age. Cervical axillary lymph nodes are most frequently involved, and it is associated with excellent prognosis. طيب الhistopathology it may have diffuse pattern of involvement in lymph node or nodular formation, nodules. Background small lymphocytes, lymphocyte predominant, so it is rich in lymphocytes and scattered macrophages. Neutrophils, eosinophils, plasma cells, and fibroblasts are scant or absent. Yani it's only lymphocytes predominant, only lymphocytes. Plus the neoplastic cells. Neoplastic cells in this type called what? The RS cells called LB cells, lymphocyte predominant cells, أو lymphohistiocytic cells لأنه بيشبهوا الهيستوسايتس، بيشبهوا الماكروفاجز، أوكي؟ تمام؟ فاسمهم LB cells, LP cells, or LH cells, lymphohistiocytic cells. What are the characteristics of these cells? Delicate, multilopated, puffy nucleus resembling popped corn, okay? فاسمهم popcorn cells. Like this. These cells, like multilopated, puffy nucleus resembling popped corn, called popcorn cells. These cells, by immunophenotyping classification or staining markers, show B cell markers, CD20 and CD45, while negative to CD15 and 30 acts the classical RS cells in the classical subtypes. تمام؟ حكينا عن most of them. Nodular sclerosis بيكون شكل cells like owner cell, RS cells, mixed cellularity more in males, older age group, unfavorable advanced stage, EPV associated, lymphocyte rich, unfavorable advanced stage as well with EPV related infection, lymphocyte depleted, HIV associated, advanced stage, poor prognosis. كمان هون lymphocyte predominant, more in males, it is uncommon, only 5%, prognosis is excellent. Stage, early stage with نوع الخلايا اللي هم neoplastic cells called what? Popcorn cells, LH cells or LP cells. Staging of lymphomas, اللي هو كمان non-Hodgkin lymphoma as well, they follow the Ann Arbor classification from 1 to 4. 1, involvement of single lymph node region or involvement of single extralymphatic organ, okay, or tissue. Stage 2, involvement of 2 lymph node regions on the same side of the diaphragm, تمام? Or involvement of limited contagious extralymphatic, limited, كلمة limited, okay, extralymphatic organs or tissue. Number 3, involvement of lymph node regions on both sides of the diaphragm. Number 4, لما يكون في عنا multiple disseminated foci of involvement of 1 or more extralymphatic organs, يكون disseminated involvement. تمام؟ طيب كمان الستaging بنضيف له كلمة A or B, 2A, 2B, related to what? To presence of what? لا.
Symptoms.
B symptoms, excellent. A لما تكون absent, the B symptoms, و B with the presence of B symptoms. B symptoms وجودها ايش بيعمل؟ Worse prognosis, تكون worse than the absence of B symptoms. طيب early stages systemic chemotherapy regarding treatment ل stage 1 and 2, advanced stage 3 and 4 the patient needs radiotherapy بالإضافة للكيموثيرابي. Stage 1A, 2A اللي هو ما فيهم البي symptoms, 5 years survival can reach 100% cure rate, remission. Advanced diseases, 5 year survival rate can reach up to 50%. طيب هلا ان شاء الله المحاضرة الجاية رح نحكي عن non-Hodgkin lymphomas. بس quick comparison, Hodgkin lymphoma often single lymph node region, while non-Hodgkin lymphoma رح نحكي عنهم multiple peripheral lymph nodes. The spread is contagious. وبالnon-Hodgkin lymphoma non-contagious. Extranodal involvement more common in non-Hodgkin lymphoma. يعطيكم العافية بس حضور الغياب.